COVID-19, novel coronavirus. It's something that's not just taken the community, a nation, but the world by storm. No one would have predicted it coming into 2020, and yet today we're in the midst of it. So what is COVID-19? What are the cautions we need to be taking, and where should we go from here? Nani Cuadrado, who is the director of Lehigh Valley Health Network Street Medicine team, will be joining us to break down those questions and more. I'm Sam Chen, and this is Face the Issues. Good evening and welcome to Face the Issues. I'm your host, Sam Chen. As you can tell, we're in a bit of a different setup today as our studio remains closed amid the COVID-19 pandemic. But what is COVID-19, the novel coronavirus? How does it spread? What information do you and the public need to know about it? And what can we all do to help make sure we flatten that curve? I'm pleased to welcome tonight Nani Cuadrado, who serves as the director of Lehigh Valley Health Network Street Medicine team. Nani, welcome to Face the Issues. Thank you so much for being here.
Sam, thanks for having me, even in this unusual environment.
Yeah, it is odd running these broadcasts from home as opposed to from our studio. But for our viewers who remember, last fall we had the Lehigh Valley Health Network Street Medicine team here, and two of your colleagues, Nani, Benny and Seth, were here talking about the great work that you guys do day in and day out, serving the homeless in the Lehigh Valley with their medical needs. So thank you for all that you guys do, especially in the midst of this pandemic now.
Absolutely.
Want to jump in at a 30,000 foot level and kind of give an overview. There's so much information out there right now and so many opinions about COVID-19, the coronavirus. Just from the 30,000 foot level, so our viewers kind of really get a grasp of what we're talking about. What is what we are calling COVID-19 novel coronavirus? What is this?
So novel meaning new. So it's a new, never identified virus, and COVID stands for corona, and VI, the vid is for virus, and D is for the disease. So it's the coronavirus disease, and it was identified in 2019. So that's where COVID-19 came from. And corona is for the spikes on the virus that look like a crown.
Oh,
so
okay.
That's where that came from.
Oh, that's interesting. So what is the virus we're hearing so much about the symptoms. What kind of virus is it? And what are the symptoms that people are showing?
So the virus is in the same, it causes a severe acute respiratory distress. So the virus itself has an affinity for the lungs, and so it likes to attack the respiratory system. So the symptoms will be just that. You'll have a fever, you'll have shortness of breath, and you'll have just all over feeling lousy, like the flu-like symptoms.
Okay, and so this is specifically a respiratory virus?
Yes, it's actually been renamed. They call it the SARS for severe acute respiratory syndrome. And so it's, when it attacks the respiratory system, it attacks it in the most severe way. So oftentimes the sequela of that is somebody has not just difficulty breathing, but often needs a ventilator just to breathe.
Okay. And if I remember correctly, there was a SARS outbreak in recent history, at least since the turn of the century. Is this different from that outbreak?
It's a different virus, but it still is a very similar virus. It was also named a SARS virus, the severe acute respiratory syndrome. And so it was indeed attacking the virus, was attacking the respiratory system. But it is different because it is more severe in nature and has spread a lot more significantly than SARS back in the early 2000s.
So just so for those of us who are not in the medical world, terms like SARS, coronavirus, these are not describing any specific virus then, right? They seem like they're categories.
So viruses are given names based on what they look like, or based on how they're. So coronavirus is actually a virus that causes the common cold, but this particular virus is a severe, so it's not the same. The coronavirus oftentimes caused cold symptoms, and so that's generally how we saw it, but this causes severe symptoms, so that's why they're actually attaching that SARS to that.
Got it. Okay.
Does that make sense?
Yeah, that clears up a lot. I think a lot of questions our viewers have too about how they name these things. We had a severe weather specialist on last season talking about storm chasing and such, and same questions of just how do we name storms? Like, who gets the unfortunate honor of being having their name attached to a storm?
Yeah.
So I think that clears up a lot. I appreciate that. With COVID-19, how do we know? What do we know about how this spreads? I mean, there's all this talk of you could carry it and not have symptoms, or it could spread through the air, it could spread on surfaces. What do we know right now about how people get it and how this spreads?
We know that it spreads droplets, and so droplets can actually manifest themselves by a sneeze, by a cough. And so if somebody coughs into their hand and then grabs a doorknob, or sneezes and doesn't cover and sprays the countertop and sprays the table, and you touch the table, then it can spread that way. So people are wearing masks often because if people aren't covering their mouth and covering their coughs and sneezes, then the droplets can spread in the air and they can be inhaled, if that makes sense.
Okay. So all these things with wearing masks and gloves are really to protect us from touching the droplets.
That's correct. So it is a droplet spread, but the issue is when people don't cover their mouth to cover the droplets, then it can spread the air and then be inhaled.
Okay.
And so that's why the masks are necessary, and the gloves and the white hand washing is if I cover my mouth and then touch the countertop or touch the gas pump, then I've now put my droplets. And if someone comes in right behind me and doesn't wash their hands and then touches their face, then it's absorbed through the skin.
Right. And that's fascinating because so even people who are doing it right and covering their coughs could still be spreading it. And it's something we don't think about in everyday life. Like, I cover my cough and then I go pump gas. It's something that people do in everyday life, which is now actually causing the spread of COVID-19.
Which is why they actually tell you if you're going to cover your cough, you cough into your elbow, because your elbow is not touching anything. So kids learn that in daycare, right? They learn to cough that way. And so, and never coughing like this, because then we touch our eyes and then we touch things. And so I think that's the reason, if all that makes sense. Yeah.
And it's funny because you watch these press conferences where they're saying, don't touch your face, and then they're touching their faces. And it's just, and we kind of laugh at it, but it's a reminder just how easy
how much we touch our face.
Right, exactly. So, Nani, let me ask you this. There's a lot of conversation right now about how this is similar to past, we talked about SARS, but they'll say this is similar to the flu, similar to H1N1, which we had 10 years ago. You're in the field as a medical professional. From your view, is this different? How is this different? What are the differences between what we have right now today versus past epidemics, such as H1N1 or even the common flu?
Sure. The severity, first of all, is, I think, the flu has always been very serious for the extremes of age, but this is not just affecting folks with extreme ages, but also immunocompromised. So persons that don't have as much to fight with, persons that are already behind the 8 ball as far as their health goes. So the severity of it is something that we've never seen before like this. H1N1, it seemed to have been isolated much quicker. And so isolated and then kept in an area. So the beauty of travel is the beauty of travel, but somebody can easily hop on a plane and without symptoms and cough in a plane and hop on a bus. And so the travel that has made us very accessible as a public has really accelerated the fact that the symptoms are being spread much quicker and much more severely.
Okay. And then the last question, close out this segment, and this is a big one. There's so much, and I'm on social media, and I see this, and where there's so many articles that are being written, or people's blog posts, or just different conversations, whether it's around flattening the curve versus herd mentality, or the whole conversation around hydroxychloroquine. The conversations on whether or not this is really a pandemic and numbers and all this stuff. And it's in our information age, on one hand, it's great because we have information at our fingertips. On the other hand, anybody that has internet access can be provided that information. Mm-hmm. Talking to the public, to our viewers, where should they be getting their information from? Who are the trusted sources that they should be listening to? Who are the trusted sources that you rely on?
So I always, our network does a lot of linking to the CDC, the Center for Disease Control. So a lot of our infectious disease specialists will follow the guidelines of the Centers for Disease Control. So both St. Luke's and Lehigh Valley have together worked on providing very good knowledge and a very excellent public health space for public information. So both Lehigh Valley has a terrific website, as well as St. Luke's. And a lot of those, if you look at that, are linked to the Centers for Disease Control, which is, for me, where I go to when I'm looking for up-to-date information about things that we should be doing or things that can be relaxed or not doing.
Well, that's great. Thank you, Nani. And so LVHN, St. Luke's, I love that the two great hospitals in our area. Really, I mean, again, everyone, and we're seeing this around the world where hospitals are working together and share teamwork, because this is everyone needs to be on this. But the CDC, that website, cdc.gov, is a great resource. And again, I thank you for that. I think it's so important that people are going to the right place for their information amid all the different opinions and information out there.
Absolutely. It's actually unhealthy, I think, to allow some of the information to enter inside, because it's just not correct. And so I think it causes a fatalistic attitude and can be actually really detrimental. So getting good information and reading it to its fullest is so very important.
Yeah, I appreciate that. Thank you, Nani. Don't
Sure.
go away. We'll be right back. Welcome back to Face the Issues. Nani, thank you again for taking the time. I know it's a busy time for you, especially for you as a medical professional. And so I appreciate you taking the time to be here with us. Moving this conversation from the what COVID-19 is to some of the solutions and some of the things that you're seeing with street medicine. We're hearing a lot of terms like flattening the curve, the stay-at-home orders, and it's a hashtag trending now. Stay at home, washing your hands, which again, I'm not quite sure why people weren't washing their hands before the pandemic, but washing your hands, wearing masks. Where is this coming from? And from where you sit as someone who is on the front lines of this, how important are these guidelines?
I think anything that we can do that will help to minimize the spread is hugely important. So hand washing, hands down, is the number one thing that we should be doing. I cringe a little bit, to be honest with you, when I see people wearing masks and then touching the front of their mask and then touching their face and touching other things. So the mask wearing is fine, but the issue is you can't forget to wash the hands. And so I think, and staying at home. I mean, when it's flu season and someone's got the flu, we tell people to stay at home. And so this is no different than that, but this is significantly serious if we don't heed those guidelines. So absolutely, I'm very pleased that you brought it up, because we are not out of the woods. We really do need to take this very seriously.
Yeah, I appreciate that. I was talking to someone who works at a grocery store, and they were saying even people who wear gloves, they come in and they cough in their gloves and then they go pick produce. And he's like, that defeats the purpose of wearing a glove.
Right. And so I think that's part of the problem is we've issued statements that people need to wear masks, but there's not really good education about how to wear masks. The Lehigh Valley Health Network does have a little video that shows how to take off your mask, how to put on your mask. and how to not infect when you're doing the right thing by wearing one.
Oh, that's very helpful. You said that's on LVHN's website?
Yes.
Okay, that's very helpful. Thank you for saying that.
Yes.
I appreciate that. There, in other conversations that we've seen with medical professionals, and it's not something we see in the media as much, but there is a conversation about a potential second wave or second curve. So the idea of flattening the curve is what we're hearing is, well, this is just the first curve that we're on right now. What is the idea of a second or potentially a third curve? And what does that mean, first of all, and what would that impact be?
I think they're expecting the second curve in the fall. And so the thing that's going to be confusing and really scary about that is that it's going to come around the same time as flu season. So Corona or COVID-19 has the similar symptoms as the flu. So it's going to be really difficult and a challenge when they come together to figure out what's the difference between the two.
And Nani, following up on the conversation of a second curve, and you had mentioned it coming around the time of the flu in the fall. What effect are we looking at? I mean, obviously, even now I have friends who reach out and they say, so for our viewers who don't know, I was one of those who tested positive for COVID-19. I'm obviously on the mend, on my way into kicking this. But I've had a lot of friends who, upon hearing that, they've reached out and said, hey, I have a cough, or I have a slight fever. Do you think this is COVID? I always tell them, go ask someone that knows their medicine, because I don't. But there's already this fear of getting it, and some people are saying, it turns out it's just their allergies. What impact are we potentially going to see if the second curve comes during flu season?
I mean, flu is tough enough. We at the hospital, we have surge tents just to prepare for the influx of patients with flu-like symptoms. I can't even imagine if we've not gotten fully over this and we hit a second curve. That curve could come earlier. Just mind you, if everybody relaxes and eases up on hand washing and wearing masks and staying at home, we could potentially see that curve even earlier in August or September, not October, which is as expected. So you think about it as two storms coming and two storms merging. I could see it being potentially very impactful if they both hit around the same time.
And that should be enough to remind people of the importance of hand washing.
I hope so.
This curve.
That should never end.
Yeah, agree. Again, I'm not quite sure why it took a pandemic for people to wash their hands, but let's hope that habit stays afterward.
I certainly hope so.
Let me ask you this. The Lehigh Valley Health Network Street Medicine team, you and your team are dedicated to bringing quality health care to the homeless population in the Lehigh Valley. You guys have been doing this day in, day out, long before this pandemic started, and you haven't stopped during this pandemic. As you do this, what impact are you seeing with the pandemic? Is it changing how medicine is being delivered for your team? Is it changing how your normal rounds with street medicine and so forth? What kind of impact are you seeing?
So it's dramatically changing. And I want to also ask some forgiveness for the noise that you might be hearing in the background. We actually are fully at work. We were out in rounds in the woods this morning, and we're back at the office restocking medical supplies and tents. And so everybody is outside of my office gathering some more supplies. So that's kind of that background noise you're hearing. But what it's done, Sam, is because of COVID, some of the shelters closed. So 2 of the emergency shelters closed, and that left 50 in one shelter and roughly 50 to 60 in another shelter now unsheltered. And so they had to disperse to the woods. So whereas we used to go maybe 3 times a week out on rounds, out in the woods, under the bridges, in the streets, we're now actually going every day. To check on folks. And so every morning we're out trying to catch people before they leave to go get a meal, and then trying to come back and restock to go back out again in the morning.
What's the impact like on the homeless population? I mean, so now they're out of these shelters. I imagine that's due to the social distancing regulations, the idea they don't want that many people in one place.
Both, actually. So not only were they worried about the social distancing, but volunteers often run shelters,
Mm-hmm.
and volunteers often that are retired. So we are
Mm-hmm.
looking at folks that are already vulnerable that were volunteering their time. And so a lot of the shelters found a decrease in volunteers because people were worried. And so therefore they didn't have enough people to staff a lot of the shelters. So the impact has been very much impacting our folks because they don't have a safe place to eat.
Mm-hmm.
Whereas you used to go into a soup kitchen, now there's a little window and people are handing out food through a little window, so the food is eaten back at a campsite, and you're not allowed to socialize. So there's not a place to charge your phone, to go to the bathroom and wash your hands. When the library's closed, which is where a lot of our folks went to connect by computer, they've lost that connection to
Sure.
persons. And so and the social services offices are closed, so Social
Oh, wow.
Security and all of the places that they went to get help are all closed. So it's profoundly impacting our population.
Wow. So all the difficulties and the challenges that we have as members of the public, where there's so much frustration with these stay-at-home orders, and just the frustration of everything being closed, and meals, and even grocery shopping has become a burden. It is tenfold with our homeless population. They don't even have a place to connect.
They don't. And what's just about to become more impactful is, as you remember, when you got COVID-19 positive, you had a safe home to go self-quarantine. So the big challenge that we're about to face, and we've been very blessed with really only one or two folks testing positive in the entire Lehigh Valley in the homeless population. So we've been very, very lucky. But what's going to happen when one tests positive and they decide to go back to their home, which is an encampment? So both Lehigh Valley Hospital and St. Luke's have worked very hard to have an arrangement with a local hotel where folks that are waiting for test results and folks that are testing positive will be able to self-quarantine, and Meals on Wheels will provide them meals, or there will be a laundry service to help. And so these have just started to come together. Actually, just on Friday, we were able to connect with a hotel that's agreed to help us with this potential crisis of staying home, but not having a safe home to go to.
Right. A stay-home order, but there is no home for them to stay at. That's just something we all take for granted.
Exactly.
And I think it sheds light. I mean, it's such a great perspective on, I think, even for us, just where we need to almost have a sense of gratitude, where there's frustration that we can't go out, but we have a place to be.
Absolutely. And we can wander around our home. Whereas if you were to self-quarantine in a tent, what kind of life is that? You still have to leave the tent to go to the bathroom outside. You still have to leave to go to a soup kitchen to go get your food. So there really is a huge public health risk in self-quarantining in a tent, which is absolutely, in my mind, unacceptable for a network or networks to allow that. And so thankfully, our hospitals are working together with the cities and the counties to come up with a better solution, a safer solution for our folks and also for the community.
Yeah, I think that's great news. Shifting to the work that your team does here, what are the challenges that you guys are seeing? Obviously, the challenges with the medical, with the homeless population, but on the medical side of it, what are some of the challenges that medical professionals are facing, whether they're in the hospitals or in their offices, or for you guys out in the field? What are some of the challenges that you guys are experiencing?
I think our biggest challenge is the instructions that we give to keep themselves healthy are impossible for someone who's homeless. So when we tell them to stay put, they can't stay put. When we tell them to wash their hands, all they have is the hand sanitizer that we bring them. And as you know, if you get gritty and dirty and then you throw alcohol on top of that, it's just like rubbing dirt into your hands. And so, yes, it can help, but there's nothing like a good soap and water to really feel like your hands are clean. And so when we tell our folks to to stay clean and to stay apart. It's really hard. It's a communal environment. And I think the things that you and I do that we can minimize the impact are just very difficult to do when you're homeless.
Yeah. And again, something we don't normally think about. Nani, let me ask you this, as a medical professional who's on the front lines, and first, thank you for what you do. And again, you mentioned that different members of your team are all coming in and out today restocking. And I think just that mental image of all of these medical professionals on the front lines they're going to work because you have to, and medical services don't stop in the pandemic. In fact, they increase during a pandemic. So thank you for what you and your team do. But as a medical professional who's on the front lines and you see this impact of the virus, what would you say if you had just a blank slate to say anything to the public about whether the regulations or the virus or what the community can be doing right now? What advice do you have for the public?
Wash your hands. Honestly,
yeah.
It sounds so simple, but like you said, why does a pandemic have to happen in order to get people to wash their hands? You can wear all the masks that you want, but then you touch your mask and you touch things. Honestly, that's the number one thing. Eat well, drink well, all the things that I tell my folks that they can't do. But we can. We have the advantage of having a home. We have a bed. We have running water to wash our hands. Let the people that don't have running water have the hand sanitizer. If you have running water, wash your hands with soap and water. I mean, those are the things to me. Let's save the hand sanitizer for the folks that really need it, that don't have running water, and let's use good old soap and water and the way it should be used. And to me, it sounds so simple, but it is the number one thing that will help prevent problems in the future, not just with pandemics, but just with spread of illness, period.
That's great advice. So wash your hands.
Wash your hands. Help flatten the curve. Honestly, it's that simple. It's good old soap and water.
And sometimes it is the simplistic things that we always overlook. So
it really is. It really is. I mean, I think that's I'm hoping it's one of the things that is the good news that comes out of this is that people get in the habit of washing their hands. I hope. I also hope it also breaks down some of there's a lot of things that can happen over the phone that do you really need to come into an office to refill a medication? No, I mean, honestly, you can probably do some of those things over the phone. So I think it's really accelerated technology to bring it to a forefront to see that actually it can work in some instances. But I know that our homeless patients are very grateful that we still continue to see them every day. And I'm very grateful to Lehigh Valley for allowing me to do the work and not sticking me in an office somewhere, that I still get to go outside.
Yeah. And we're grateful for what you do and what your team does. So thank you for all of that. We
Absolutely.
That. Well, that is all the time that we have tonight. My thanks to Nani Cuadrado for joining us and for breaking down this incredibly important issue of COVID-19. And her advice rings true. Wash your hands. So my thanks to Nani and her team for all they do. Thank you for joining us. Keep this conversation going online. Just remember to use the hashtag #FaceTheIssues. And join us again next week as we continue our conversation on COVID-19 and its impact on our communities. My name is Sam Chen on behalf of all of us here at Face the Issues. Thank you and good night.